Hey everyone, Professor Davis here, and we are going to be looking at the musculoskeletal system here in medical terminology. So I'm going to try to make this as short and sweet as possible, so let's get started. So first things first, let's talk about the function of the musculoskeletal system, because technically it's the muscles and the skeleton, which are kind of two separate systems that we're putting together here. So we have function here for support. It provides support when we talk about the bones. It gives you shape. It also acts as a framework. This framework helps have attachment for your arms, attachment for your legs when we talk about the pectoral girdle and the pelvic girdle. We also see it protects, and so we do see that there is a lot of times a set of bones that protects an area, like the cranium. We see it protects the brain. The rib cage protects the lungs and the heart. We also see movement. So the bones are going to be the places of attachment for the muscles. The muscles then, when they contract, allow for movement to take place. We also see storage of minerals, specifically in the bones. This is going to be where we would see the storage of calcium and phosphorus. And then hematopoiesis. Hematopoiesis is the formation of blood, red blood cells, white blood cells, platelets, and this takes place in the bone marrow. So before we get started, let's kind of do a little review about bones. And so when we look at bones, remember that bones can be classified in a number of different ways. They can be classified as long bones, meaning they're longer than they are wide. Short bones are kind of cube-shaped bones like we have in our wrist or our ankles. We also have irregular bones, which just have an odd shape to them, like vertebrae. Flat bones like the sternum, cranial bones. And then we also have the sesamoid bones, which is like your kneecap or your patella. When we look at the long bone, though, one thing we want to see here is there are some different parts to it. So the two ends of the long bone are called the epiphysis. The area in between is called the diaphysis. That's like the shaft of the bone. If you go into that shaft, that diaphysis, on the inside, it is going to be their space. It's like a cavity. We call that the medullary cavity. In this cavity, blood vessels do run, but we do see that this is where yellow bone marrow is going to be found. Yellow bone marrow stores fat for us. Now, if we go back to the epiphysis, the two sides, that is going to be where we see the red bone marrow. Red bone marrow is going to be where the formation of red blood cells, white blood cells, and platelets takes place, that hematopoiesis we just talked about. We also see that the bone, when we're talking about the spongy bone as well as the compact bone, is going to help us store calcium and phosphorus. And we do see that there is a constant remodeling that happens in your bones, where we build and then we break down and then we build and we break down. And we do this because it's going to help maintain a balance for your minerals in your bloodstream. Because calcium is important not only for your bones to be strong, but calcium is also important for your muscles to contract. It's also important for your nervous system to work. And so we have to make sure there's enough calcium in the blood and available to those systems and not just stored up in your bones. When we also look at this, guys, you see that there is going to be cartilage on both ends. We call that the articular cartilage. In this case, there's a epiphyseal line, which is going to be where the growth plate used to be. So if there's a line that's an adult, in kids, this would be a wider space, and that's going to be the growth plate where the bones actually grow in length. Compact bone is on the outside of these bones. Compact bone looks like tree rings. When we talk about that tissue, it's very compact, organized in structures called osteons. Whereas the spongy bone has lots of spaces in it, like a sponge. And so that again is where that red bone marrow is going to be stored. Let's talk about some bone word parts. So we have blast or blasto. That is an embryonic form. A lot of times we would call it an osteoblast, a chondroblast, and it's an early stage cell. These guys are the ones that are going to be more metabolically active. They're early stage, and they are normally going to be the builders that we see. Osteo is bone or bony element. Osteo is bone. So when we talk about osteoarthritis, that is an arthritis with the bones. We also see you can do osteoichthyes. Now that's obviously not for the human body, but that's a bony fish. And so that's what we can use there. Myleo is going to be talking mostly about the bone marrow. Sometimes we also see this term used for the spinal cord, which we'll talk a little bit more in the nervous system chapter. Another thing we want to hit on here is when we talk about calcification. Calcification is the process by which organic tissues become hardened by mineral deposits. And so this is going to be where we are taking that calcium and we're putting it into the bone to harden it up in order to give it that matrix, that structure for that connective tissue. Osteogenesis and ossification are kind of interchangeable. When we talk about some of these words, it is going to be the whole idea of formation of bone, the beginning of making bone. And the human embryos contain no bone, but we see that there's a framework of cartilage to start with. It's kind of like it makes a mold out of the cartilage, and then we're going to replace it with the bone. That idea of replacing the cartilage with bone is known as the ossification process. And there's two types that take place depending on what kind of bone we're looking at, a long bone or like a flat bone, but they take place during that embryonic development. Okay, so we see that it starts as cartilage and then it becomes ossified through ossification to become bone. All right, so the human skeleton, if you've taken anatomy and physiology, you had to learn these bones. Okay, knowing the bones, there's 206 of them. We do know that the skeleton's divided into two main parts. The axial is this middle plane. Okay, so we're talking about the skull, your vertebral column, your rib cage. That's the axial skeleton. The appendicular skeleton are your appendages. So your upper appendages like your arms, lower appendages, your legs. Okay, and so those are going to be the appendicular skeleton. So there's two kind of divisions. Now you do need to review these because a lot of times we will use these terms to give a location or a comparison of where some of these bones are located together or a joint that is formed by the two bones. And so you need to kind of review these. So you have the skull, and we're going to talk about the bones that make up the skull because there are a lot in just a second. The vertebral column is made up of the cervical, thoracic, and lumbar vertebrae. And then we also have the sacrum and coccyx that are part of that. If you look at kind of the bluish areas, you've got the clavicle and scapula here. Those make up the pectoral girdle, where then the humerus, the arm bone, fits in. In your forearm, you have the radius and ulna. Now, in anatomical position, the ulna is up against the body because it's the pinky side. The radius goes towards the thumb. We also see that in the hips, we have the pelvic girdle, and that's going to be with the ischium, ilium, and pubis bones all fused together to create your hip bone, which we call your coxal bone. We see that that is going to create that girdle to where the femur then attaches. The head of the femur comes in. That's the bone of your thigh. In your leg, we see that you have the tibia and fibula. Now, your foot and your hand are very similar in their structure. You have these kind of square-like bones that are called short bones that are going to make up the carpals. So carpals are the wrist. Metacarpals are this part that make up your palm. And then, of course, phalanges for your fingers. Your foot is similar, but instead of being called carpals, we see the ankle bones are called tarsals. The arch of your foot are the metatarsals, and then your toes are also phalanges. Now on the skull is made out of the cranial bones as well as the facial bones. They fuse together to create your skull or your brain case where the brain is located. So when we talk about the cranial bones, you have, of course, the frontal, the parietals, the temporal, and we also have occipital back here. There's two bones inside that make up kind of the base of your cranial cavity that you can't really kind of point out, and that's the ethmoid and the sphenoid. Those are all going to be the cranial bones. The facial bones are going to include things like your nasal bones, the lacrimal bones, which is going to be where your tears are going to drain into your nasal cavity. We also have the zygomatic bone, which makes up your cheek. We see the maxilla and the mandible. Okay, the top of the mouth is going to also have the palatine bone along with the maxilla. And so there's a lot of bones that make up the face as well. So let's talk a little bit about the spinal column. When we look at the spinal column or the vertebral column, we do see that there are sets of vertebrae. So the cervical vertebrae are the top, and those are found in your neck. They are the smallest. Okay, and there are 7 of them when we're looking at them. Vertebrae 1 is called the atlas, and vertebrae 2 is the axis. The atlas allows you to say yes, and the axis allows you to say no with your head. Okay, and so those two are really important. So cervico is what we see for the neck bones, and we a lot of times abbreviate these as C1 through C7. We then have thoraco or thoracic. This is going to be more in the actual back, that's going to be in the chest area, the thoracic area. These guys are going to fuse with your ribs, and there are 12 of them, so it goes from T1 to T12. So they're going to help form your chest or your rib cage. The lumbar is your low back. With your low back, there's L1 through L5. These guys are really large vertebrae because they do contain or take in a lot of weight. With that, there's also large muscles that attach to them. So that's the lumbar. Then you have your sacral and coccygeal. Those two have been fused together to make up your kind of tailbone and sacral area that merge with your coxal bones, your hip bones, to create your pelvic girdle. And so those bones are fused. When we're kids, they're not. They are the separate vertebrae, but they fuse as we age. It is important to note that the spinal cord does run down this, and in between each of the vertebrae, there is going to be cartilage that adds for cushion, support, and shock absorption. All right, so let's talk just briefly about the thoracic cage or the rib cage. We do say that the ribs do connect to the sternum, which is your breastbone. The connection of the ribs is going to be direct if they're called true ribs. So the true ribs are going to be the first 7 that connect directly to the actual sternum. Then you're going to notice that we have some that are false ribs, which are 8 through 10. They do also connect to the sternum, but indirectly. So it's cartilage connected to cartilage connected to then the sternum. We see that the last 2 ribs are floating ribs. They're not even connected to the sternum, and this is going to be 11 and 12. Now, there are going to be a ton of muscles that fit in between these ribs, and they are going to help with breathing. And so not only do they offer a protection and a cage for your lungs and your heart, they do also have the function of helping you breathe. All right, so let's talk about some word parts that deal with the shoulder to hand. So we're talking about in the appendage, and we're going from the shoulder down to the hand. So you have clavicle, which is talking about the clavicle bone. You have scapula, which is going to be the scapula back here called your shoulder blade. Humero is the humerus, that's the arm bone in the top of your arm. Radio is for radius, and ulno is for ulna, so these two are in your forearm. Phalanges, of course, are the fingers, and if we're talking about one, it's called the phalanx. Carpo is going to deal for carpus, which are your actual wrist bones, and so you hear a lot of times like a carpal tunnel is an issue with the wrist due to these bones. And then metacarpals are going to be for the palm of your hand. So we can actually combine these words kind of together to give us a location or a connection. So sternoclavicular is talking about the area where the sternum and the clavicle come together. So like right here. We also have scapular, which means pertaining to the scapula. Humeroscapular is going to be where the humerus and the scapula bones or the shoulder blade come together up here. Ulnar radial is where the ulna and the radius come together, and that can happen either here on the distal end or the proximal end. And then the humeroulnar is going to be where the ulna connects to the humerus. And so this is just to give you an idea of how we can combine a lot of these words to give you a location, and joints are normally going to be named based on stuff like this. We then have the pelvic girdle. The pelvic girdle is going to be made up of 3 main bones that make up that hip bone. So the ilium, the ischium, and the pubis, and we do have some word parts that deal with those 3. When they come together, they make that actual hip bone or coxal bone. Examples of when we would use some of these word parts are iliofemoral. This is where the ilium and the femur come in contact. Okay, it's pertaining to that area. You have the ischiopubic is where the ischial bone with the pubic bone fuse together. And then you have the ischio-coccygeal, and this is going to be where the ischium is going to come in contact with that coccyx sacral area. With the leg and foot terminology, you're going to notice it's kind of similar in structure to the arm. You have a 1 bone structure in the thigh, 2 bones that make up the actual leg, and then you have the ankle bones and for the foot. And so it's similar to what we saw with the upper extremity. So femoro is talking about the femur. Patello is talking about the patella, which is a special bone that's located in a tendon that connects your quads, which is the big muscles on the front of your thigh, down to your tibia bone. Tibia is tibia, fibula is fibula, and those 2 bones are in the lower part of your leg. Tarso is talking about the tarsus, and those are going to be the bones of the ankle. Calcaneo is the calcaneus, and that's your heel bone. So that is where there's a little difference from there to your hand. This is a larger bone that makes up your heel. Metatarsal are going to be the metatarsal bones that make up the arch of your foot. And then, of course, phalanges are your fingers and your toes, and phalanx can also mean one finger or one toe. So we have patellar femoral. This is going to be where the patella and the femur are going to be close together. It's pertaining to that area. Tibiofibular is very similar to the radial ulna area, where we see at the proximal end by the knee, these guys come in contact, but also down by the actual ankle. Tarso-metatarsal is going to be where the tarsal bones come in contact with the metatarsals, that particular area. And the calcaneofibular area is actually the outside part of your ankle. It's where the fibula comes in contact with your calcaneus or your heel bone. So these are what we're talking about from leg to foot. All right, so let's switch gears a little bit and talk about joints. When we talk about joints, this is where bones come together. And a lot of times some of these joints, when we're talking about these, are called synovial joints, meaning they have a special structure because they have a cavity around them. And it helps with movement, reducing friction, and all those types of things. So joints are where two bones meet. Now, connective tissue is really important in this. It's going to be abundant, and we're going to use that to bind these joints together. Joints are also known as articulations. Some joints are not movable, like we talk about the joints in your head for your sutures. They're not movable. Okay, or the joint between your bone and your tooth should not be movable if it's your adult tooth. But others are more freely movable. These are going to be things like your ball and socket with your shoulder, where you have lots of movement, or your fingers. Okay, and so they have a range. So we can have no movement, a little bit of movement, or a lot of movement. Now, when we talk about joints do tend to have that articular cartilage on the ends of the bones, and that's helped give some cushion, some shock absorption, so that the bones aren't bone on bone when they move, okay, because they are going to be in contact there. Some joints, when we look at this, have other special things to reduce friction embedded in, and they're called the bursa. Bursa are fluid-filled sacs that help with rubbing so that the tendons don't rub together or the different tissues don't rub together, because if they rub together, that can create friction, which causes heat, which can be a problem for our cells. We do see in joints there's going to be two things that come into play. We have tendons. Tendons are going to connect muscle to bone. Okay, so remember, tendons do muscle to bone. Ligaments, on the other hand, connect bone to bone. So if you're looking at the structure here in the knee, you can see that there are ligaments in the B picture where they're holding the bone together. We call that the anterior cruciate ligament. You also have the posterior cruciate ligament. You have the collateral ligament. They're holding those bones together. However, on the other hand, in A, you can see that there's going to be a tendon that runs across the front of the knee that the patella is embedded in. That is known as the patella tendon, and it connects, again, the quadricep to the lower leg bone, the tibia. So when we're talking about joints, there's going to be some word parts that come into play. So we have artho or articulo, which is for joint. Bursa is the fluid-filled sacs we talked about. Chondro is the cartilage. So anytime you see chondro, it's talking about cartilage. Synove or synovial is the synovial membrane, which is that capsule that allows for fluid to be in there to lubricate the joints. And then tendo, and tendon is going to be for talking about those different tendons that connect muscle to bone. All right, so this leads us to actually looking at the skeletal muscle. So we talked about the skeletal part. Now let's talk about the muscle part. Okay, because this is the musculoskeletal system. And so there are three types of muscles. The muscles we're focusing in on this chapter are the skeletal muscles. These produce the actual movement of your body. They are voluntary, meaning you have conscious control of them through your nervous system. The other two are talked about in other chapters. So visceral are going to be the muscles that are the smooth muscles that make up your internal organs, like your stomach, your intestine, your bladder. These are involuntary. They are going to work on their own, controlled by your brain as well, but not where you're conscious of them, right? You don't have to worry about, oh, it's time for my food to move from my stomach to my intestines. It'll do it itself because it's an involuntary type of movement. And then, of course, we have cardiac muscle. Cardiac muscle is the muscle that's found in the heart. This is also involuntary. You do not have to remember to make your heart beat every second, thank goodness, because eventually we'd forget and then we wouldn't be here. So some skeletal muscle naming terms that come into play, they're important because when we talk about skeletal muscles, there's over 600 of them throughout your body, and they are important, again, for all types of movements that are present. And they do get named a lot of times based on some sort of category. All right. And so when we look at this, most skeletal muscles have names that describe some sort of feature of that muscle, whether it's their color, their shape, their location, their size, their action. It could also be their origin and insertion, like where they attach on the two different types of bones. It could be based on what direction their fibers run. So there's a lot of different ways that we can name muscles. So some examples, the location of some muscles like your cheek muscle is called the zygomaticus because it connects to the zygomatic bone. There's one, it's called the zygomaticus major, and it goes from the zygomaticus to the corner of your mouth, and it's the muscle that helps you smile. We also see that it could be named based on how many insertions that are present. So the biceps brachii, which is just your main muscle right here, biceps tells you there's two. There's 2 points of insertion that take place. So if bicep has 2, what does tricep have? Well, tricep has 3. One based on size, this would be like your gluteus maximus. This is the very large muscle in your rear end. It's called maximus because it is large. Okay, and so that's using the actual size to name. Another one is the deltoid muscle. The deltoid's named based on its shape. The deltoid, when we talk about the Greek alphabet, is a triangle, and this is a muscle that comes across your shoulder and makes a triangle shape. All right, and so it kind of engulfs your shoulder as a triangle. And so these are just some examples of how muscles are named. And in your book, you have a guide that's kind of labeled with a lot of these different muscles and how they're named, and they color code them for you. So you can kind of see, well, which one are for the directions of the fibers. They'll have a certain color to them. All right, and so this just helps us with naming. Another thing to note about muscles is that they do help us with different types of movements. And a lot of these movements are opposites. So you have flexion, which is to bend or to decrease the angle. And extension is to increase the angle or to kind of straighten out. Okay, so they're opposites. And this can be seen really good with your elbow and your knee. Although you can also do flexion with an extension with your head. So when I bring it down, this is going to be flexion. When I come up, this is extension. We also see that we can have abduction and adduction. Abduction is moving away from the body. Adduction is bringing it towards the body. We have rotation, which means just what it says. You're rotating. It's like your head. If with your hand, you have a special movement where we have supination, where the hand is pointed up, so you can put soup in it technically, like if you're holding a bowl. Pronation is whenever the hand is pointed down. Circumduction is seen with your shoulder, and it's where you can go all the way around in a circle. We also have some special kind of movements when we talk about like your shoulders. We can actually bring them up, okay, when we talk about that, and we can also press them down. So when we talk about this is elevation, and we have depression. You can also do that with your mouth. So you have depression, you have elevation when you close it. Okay, we also have protraction, so you're going to pull forward like this with your shoulders, and then retraction where you pull them back. Okay, so there's some special movements with certain parts of your body. Your foot also has some. If the sole of your foot goes inward, we call that inversion. If the sole goes outward, it's eversion. If you go up on your toes, it's called plantar flexion, but if you pull your toes up into the air, it's called dorsiflexion. So we have, again, lots of different movements. So now that we've kind of gone through the process of reviewing the different types of anatomy with muscles and bones, let's talk about some of the diagnostic tests and procedures that are present in this system. So we do have something called the electromyography. This is used to record the response of muscles to their electrical stimulation. How well are they working? Is it a muscle issue? Is it a nervous issue? How is that connection between the muscle and nervous system working? We can also do bone density type of testing. This is a bone densitometry, and this is going to be one of several methods to determine bone mass. And so it's a machine that measures through kind of like rays that penetrate the bone and tell us about your bone density. We also have a lumbar puncture. This is performed in various therapeutic or diagnostic procedures. If we use it for diagnostic purposes, includes obtaining cerebral spinal fluid. We want to measure the pressure behind that. We may want to look to see if there's any kind of substance that's present, like a type of invader. If it's cloudy, we can also inject different kinds of radiographic material in there for studying of that area. Therapeutic indications for the lumbar puncture would be removing blood or pus from the area, injecting drugs into the back like we see with an epidural. And so those are going to be some things like with a spinal, that kind of stuff. Lumbar puncture is named because the needle is inserted between two vertebrae, specifically a lot of times the lumbar vertebrae, but it might be a little higher in the thoracic area depending on where it's needed to be. We also have the arthroscope or arthroscopy. This is going to be where we use a fiber optic instrument used to give direct visualization of the interior of the joint, so like a camera going in, allowing us to be able to see what the joint looks like from the inside. The process of this is called the arthroscopy. It permits a biopsy of things like the cartilage. It can help repair damaged synovial membranes. It can help you repair torn cartilage, like if you have a torn meniscus in your knee. It could also be used to help clean the joint out if there's loose bodies that are kind of floating around in there. And so there's a lot of different ways that this one could be used. We also have arthrocentesis. Arthrocentesis is a surgical puncture of the joint with a needle. This is performed to obtain samples of the synovial fluid. This is so we can diagnose certain things. We could also use it to remove any excess fluid. If you have too much fluid in your joints, that can help relieve some pain. Or we can actually use this to instill and put in medications into the joint. There's also some laboratory tests that we can end up doing that deal with the musculoskeletal system. The first one is the erythrocyte sedimentation rate. We call this the ESR. This is a blood test. A lot of times it's also called the SED rate. This is a blood test where we look at the rate at which the red blood cells settle out of a tube of blood that's being treated to prevent clotting. And so this is to try to help with looking at the inflammatory response. We may also look for RA, which would be rheumatoid arthritis, and osteomyelitis if there's infection, but this would be a test we might use for that. We also have rheumatoid factor, or RF. This is going to be where you do a blood test and you look for this particular protein factor. If it's located present in the blood, there's a good chance that they have rheumatoid arthritis. It could be lower levels in other connective tissue disorders as well, but normally it's an indication of rheumatoid arthritis. We also have serum uric acid levels. This is going to be where we're looking at how the body is processing uric acid. And so if you have elevated levels of this, a lot of times this is going to get deposited into your joints as little crystals. And this is what causes the type of arthritis that we call gout. It looks like little shards of glass in there because the uric acid's collecting in the joint instead of being removed by the kidney. The next thing we want to look at are some of the musculoskeletal disorder word parts. So ankylo is one that's in here that means stiff. Sclero means hard. Trophy means nutrition. Asthenia is weakness. And then sarcoma is a malignant type of tumor specifically to the connective tissue. So when we look at the musculoskeletal pathologies, they fit into one of these types of groups normally. It could be due to stress or trauma injuries that take place. It could be metabolic disturbances that are causing the problem, infections, tumors and malignancies, congenital defects, meaning that they're born with this problem, arthritis or connective tissue disease, or we would call them muscular disorders. And so some of these deal with muscle and bone, some are more bone, some are more muscle, but they do fall into groups. So we're going to talk about each of these groups briefly. Now there are lots of different things that fall into these groups, and we're going to hit on some of the high points as we go through this chapter. So the first one we're going to look at is stress and trauma. And so there's lots of different things that you could do for stress and trauma that affect the musculoskeletal system. Is myalgia. Myalgia is muscular pain. Another word that means the same as myalgia is myodynia. Another type of stress or trauma we can see is a rotator cuff injury. Rotator cuff injuries occur a lot of times due to repetitive movements like throwing a ball or golfing or doing tennis. And so you see a lot of times in the shoulder there. It could also be due to an injury. It can degenerate with age. But guys, the rotator cuff is a series of muscles that makes a cuff around the shoulder to allow it to have some stability while it moves in lots of different ways. These muscles are super small, but if they end up getting affected with the tendons or the muscles, it can cause major pain and discomfort in the shoulder and a lot of loss of function. And so a lot of times surgery is needed to repair this. We then have rachiodynia and rachialgia. These mean painful conditions of the spine specifically. Then we have spondylalgia, which is pain in the actual vertebrae. We then have chondritis. Chondritis is inflammation of the cartilage. It can cause actual pain and discomfort. This could happen with low back pain because remember, cartilage is going to be found in between each of the vertebrae, and so it could cause some pain there. If we see this low back pain continues, and let's just say the cartilage like slips out of that area and we have more bone on bone, we would call this like a slipped disc or a herniated disc. It's moved out of where it needs to be. So the next one is the Dupuytren contracture. This is a musculoskeletal disorder that the cause is not known. What it does is it causes a thickening and tightening of the palmar fasciitis or fascia, which causes the fourth and fifth finger, so we're talking about your ring finger and your pinky finger, causing them to not be able to bend properly, and so they actually get drawn in towards the palm and they don't want to be straightened. Okay, it causes them to want to be extended and they can't straighten out. Another type of trauma that is present is going to be fractures. There's lots of different types of fractures that can take place with our bones. We can have what we call an incomplete fracture. Incomplete means the bone didn't get completely broken. This could also be known as a green stick fracture. We could say it's simple in the sense that it didn't break the skin. So when they put simple there, it means that it broke the bone, but it didn't break the skin. We can also have a complete fracture, which means it did completely break the bone all the way across, but it also was simple because it stayed intact with the skin. We can then have what we call a compound fracture. This means not only is it maybe broken all the way through like it's a complete fracture, but the compound tells you now we have an open wound. The bone is actually sticking out through the skin. Another type of break is an impacted break. This is going to be where the bone gets pushed towards each other. This happens sometimes like if you try to catch yourself with your hands, or if you are in a car accident, your feet were on the dashboard and it pushes them back, it impacts them, can cause some major issues. Commuted means the fracture is broken into pieces. It's not a clean break. There's little pieces that have happened with the break. We also then have a displaced spiral and a displaced transverse. Spiral is more at an angle, transverse is a cross. And these are just some examples of some of the fractures that can take place with our bones. Now let's switch gears a little bit and talk about some of our metabolic disturbances. And this is going to be metabolic first, then we'll talk about infection second. So there is a very kind of delicate balance between building bone and destroying bone. Okay, we want to make sure our bones are strong, but we also want to remodel them to be useful in what we're doing with our bones during that time of our life. And so if either one of those gets out of whack, like we're depositing too much bone too quickly, so that's more quantity, not good quality bone, it can cause problems. And if we're tearing down the bone too fast, it can also cause issues. So an excessive formation of bone can lead to abnormal hardness of the bone. However, it makes the bone heavy, and it does also cause them to be pretty brittle. Even though they're thick, they're not very good quality bones. This is called osteosclerosis. We then can see, despite their density, that makes them fracture a lot easier because they're not good quality bone. We also see that we can have osteolysis, which is the opposite, where we're tearing down the bone too quickly. This can also lead to something that we call osteoporosis in women. Well, in anybody, but it happens to women more often due to estrogen levels that drop during menopause. Another one is going to deal mostly more with vitamin D and calcium. So vitamin D aids in your ability to absorb calcium. We have a little problem with this though, because vitamin D can be created by us with sunlight. But we don't go out in the sun without a lot of times SPF protection, which turns off our ability to create vitamin D. And so this a lot of times is why we're seeing a lot of people nowadays with vitamin D deficiencies, because they're not going out in the sun and actually allowing that vitamin D to be made. Now, vitamin D helps you absorb calcium. So if you don't have enough vitamin D, you can eat all the calcium you want, but you're not going to absorb it like you should. So if there's a deficit in your vitamin D, which results in an insufficient calcium absorption, we call this calcipemia, decreased level of calcium deficiency. We then see that this can lead to where our bones become abnormally soft, and we call this osteomalacia. Now, this one can be reversed if we get the calcium being absorbed, we get the vitamin D back up, we can build those bones back up to be stronger. So some infections, anytime you see itis, again, that is an inflammation. So osteitis is inflammation of the bone. We can also have, which can lead to osteoalgia or osteodynia, which is just bone pain. We also see if there's an actual infection in the bone, this is called osteomyelitis. If it's in the bone marrow, we would call it myelitis. We also can see that infections that deal with the skin and then go deeper into the connective tissue is going to be cellulitis. And if it involves the muscles, we call that myocellulitis. Tumors and malignancies, we do see that there are benign bone tumors that can form. These are known as chondromas. That's going to deal mostly with the cartilage. We also can have osteochondromas that can take place where there's a connection between where the cartilage and bone meet. Bone cancers that are malignant are very aggressive, and these would be things like multiple myeloma. And this actually affects all blood cell production, white blood cells, red blood cells, and platelets, because it destroys the bone. We can also have fibrosarcoma, and this is going to be where it's more of the fibrous tissue that's found in the bone. And then we can have chondrosarcoma, which is going to be with the cartilage. Another one that's not on here is osteosarcoma, and that's actually tumors in the bone itself. Those are very aggressive tumors, and the main way with treatment for those would be amputation. Another type of actual malignancy or cancer we see that deals with the bone is leukemia, because this is going to be an issue where we're talking about the proliferating cells, which are found in the bone marrow. So we have the lymphocytic or lymphoblastic type of leukemias. They can also be acute versus chronic. So you can have acute lymphocytic leukemia. If we're talking about abbreviations, this is known as ALL. We have chronic lymphocytic leukemia, which is CLL. Now, acute leukemia tells you that it was a sudden onset, and chronic tells you it's developed slowly over time. And it has similar kind of symptoms as acute leukemia, but it doesn't appear for years. Like, it's a slower process when we're talking about that. We also have myocytic or myelogenous. This is going to be acute myelocytic leukemia or AML. And then we also have chronic myelogenous leukemia, which is CML. All right, so some congenital defects. These are going to be defects that the child is born with. Some of these are, a lot of these are not going to be necessarily genetic. It's going to be kind of due to environment as well as maybe some genetics that cause these issues. The first one is spina bifida. It is a congenital abnormality characterized by a defective closure of the bones of the spine. So the bones don't fuse like they're supposed to in the spine, and so there's an opening that happens. Now, this can actually be very severe if there is a sac that forms with cerebral spinal fluid, and the actual spinal cord is also in that sac. And so that can create a lot of problems for the child if they have spina bifida. Some spina bifida is very asymptomatic. They may not even know they ever had it. It's very controlled, small defect. Large defects are more of an issue. We also have craniocell. Craniocell is a hernial protrusion of the brain through a defect that happens in the skull. This is the same as an encephalocele, so just meaning that the brain is herniating out and it's pressing into an area. And this can be seen a lot of times with the fontanelles. If the skull is not formed properly, it can have a protrusion that takes place. Rachis is a split spine. This is a congenital fissure or split in one or more vertebrae that takes place. Another one is kyphosis. This refers to the convexity of the curvature of the thoracic spine. We also would call this a lot of times a humpback that happens. Another one is polydactyly, and this is the presence of many digits on the hands or toes where you have extra. You don't just have the 5 on each. You may have 6 fingers on one hand or 6 toes on one foot. The next group are the arthritis and connective tissue disorders. So arthritis is any inflammatory condition that happens with the joints. It's characterized a lot of times by pain, heat in the joints, swelling, redness, limitation in the movements, like it limits how much movement you can have in the area. There's osteoarthritis, which is just kind of the wear and tear arthritis. There's rheumatoid arthritis, which is an autoimmune one. There's gout. There's lots of different types. So lupus erythematosus is another one, and this is an autoimmune disease that involves your connective tissue. There's 2 kind of classifications of lupus. There's more of like the cutaneous side of the lupus, and then there's more of the systemic. So cutaneous is going to be more superficial. The systemic is going to be deeper, dealing with more of the actual organs. This one is more fatal. Gout is a type of arthritis, but it is a systemic disease associated with a error in how you process uric acid metabolism. So individuals with gout have to watch their diet because they cannot process red meat very well, and it causes them to have flare-ups with that uric acid depositing into their joints. This can be very painful, and a lot of times it starts first with depositing these uric acid crystals into the joint of the big toe. But it can be any joint. That just tends to be the one that's more of the issue. Ankylosing spondylitis. This is going to cause inflammation and stiffening of the spine. Specifically, it tends to happen a lot of times in the neck, but it can happen in any parts of the spine where it stiffens up. It's kind of like it's fusing when it should not be. The last one on here is Lyme disease. This is an infection caused by a bite of an infected deer tick. Symptoms in the early stages of the disease are a circular rash that takes place on the skin. You feel kind of ill, you just don't feel good. Fever, headache, and muscle and joint aches. If you get prompt antibiotic treatment, it can actually help a lot, and it's very effective. But without treatment, a small percentage of infected persons will develop arthritis in a lot of their joints, as well as heart and neurological problems that can occur. The next one are the muscular disorders. The muscular disorders are going to be things like polymyositis is an inflammatory myopathy that involves many muscles. This can lead to atrophy of the muscles where they start to get smaller. It could also contribute to weight loss, fatigue, and gradual weakness of the muscles. We can also have chronic fatigue syndrome. This is a disorder characterized by disabling fatigue, but it is also accompanied by a lot of times complaints that include muscle and joint pain as well as headaches. And so this is why it's kind of classified here. Fibromyalgia is also called fibromyalgia syndrome. It's characterized by widespread non-articular pain in the torso, extremities, and the face. So it's not the joint. It's actually like in other areas near or around the joint, but it's not the joint itself that's causing the problems. That's the issue. That's what makes it different than, say, like arthritis. The next one is myasthenia gravis. This one is a disease of an unknown cause, like we don't know what causes it, but it is characterized by fatigue and muscle weakness. It results from a defect in the conduction of nerve impulses. We do feel it might be restricted to one muscle group, or it could be generalized to more muscle groups. It may affect any muscle in the body, but it especially affects those of the eyes, face, lips, tongue, neck, and throat. All right, so going back to this idea of fractures, this is one of those big things where treatment is going to be a big issue when we talk about bone breaks. And so orthopedic surgeons restore fractured bones to their original positions. They can do this by using what we call reduction. Reduction is pulling the broken bone fragments until they align. And we can do this closed-wise in the sense that they don't have to open the patient up to do this, and they can use like x-rays and stuff to help with it. Or they can do it openly where they have to do a surgery. They open up the patient and then put the bones back together. Another thing used for treatment is splinting or immobilizing. This is going to restrain and support the injured part so that it can heal. Bones can take anywhere between 6 to 10 weeks to heal. Kids heal faster than adults, but to actually get the strength back in that bone the way that it was before can take up to 6 months to a year. And so splinting in that early stage is going to be helpful in helping with healing. Sometimes we have to go further than a splint and we have to actually put a cast. This is a stiffer and more solid dressing. It's formed out of plaster of Paris, and it's going to help immobilize and allow again that healing to take place. Another thing they can use when we talk about broken bones is they can do traction. Traction's used to pull with force to pull it apart and allow for realignment to occur. This helps prevent like deformity when it's a large type of break. We then see if the break is bad enough, we may need to do a type of fixation. Fixation can be internal, where they put a rod, they put a plate, they put screws in. That's going to be on the inside where you don't see them, but they're still present. External fixation means that we're going to end up putting like a halo around it. So you've seen like with their legs where they have this kind of bar that's around it with screws going in, and that's what they're going to heal. You might see it also along their head where they have screws coming in. It helps hold their neck up if we're talking about traction with the neck, if somebody's broken their neck. That's an external, and external fixations are going to give you an increased risk of infection. The next thing is surgical and therapeutic interventions. And so when we're looking at some of these interventions, you can see that we have osteoplasty, which is going to be a surgical repair of the bone. We have a craniotomy, which is going to be where we're looking at excision of a segment of the actual skull, where they'll take like a piece of the skull out. A bursectomy is going to deal with the bursa, so to excising or taking out the bursa. We then have tenorrhaphy. Tenorrhaphy is going to be a union of a divided tendon by suturing it together. This sometimes is done a lot of times in the elbow. We then have arthrochalasia. Arthrochalasia is when the joint gets all stiff, we have to break it up. And so this is when they go in and they break up that stiffness that's in the joint. We then have spondylocendesis, and this is a fusion of the spine. And so if you've got herniated discs, lots of rupturing, they may need to fuse the spine. And then last on here are bone marrow transplants. And this is where they have to eradicate the bone marrow you have, which is going to increase your risk for infection, not able to fight off potential invaders, but then they would then transplant the bone marrow in. It is super important that this is a match as close as possible, because otherwise the bone marrow may then attack the recipient. Normally when you get a transplant, the body attacks like the new heart or the new lung or the new kidney. The issue here is that the bone marrow can attack the person that it's been injected into. So we have to make sure that it is a close match. All right, so pharmaceutics here, we're talking about the pharmaceuticals. We have analgesics. This is going to be like a type of pain medication. We have anti-inflammatories. These, of course, are going to reduce inflammation. Bisphosphonates are types of medication that actually can trigger osteoporosis, so they're not good for your bones. We also have disease-modifying anti-rheumatic drugs, or DMARDs, DMARDs, helping fight autoimmune issues for rheumatoid arthritis. And then, of course, muscle relaxants. If your muscles are all tight and they're cramping up and they're causing spasms, we need them to relax in order to allow for healing, or even to find out what's wrong with the patient, getting their muscles relaxed enough to be able to look. Last but not least, we have our abbreviations. So some anatomy examples of some abbreviations. You have ACL, which is anterior cruciate ligament. I actually tore that when I was in high school. That needed to be repaired when I played basketball. We have TMJ, which is a particular joint. It's the temporal mandibular joint, so it's right here, and you can actually feel it when you open your mouth up. Okay, that's the TMJ right there. Some diagnostics examples of abbreviations. We can have CPK. This is where we're looking at creatine phosphokinase. It's a type of enzyme we're looking for. ESR is erythrocyte sedimentation rate, which we talked about earlier. ROM is range of motion. This is going to be where if we have an injury like in a joint or a muscle, we would want to see what the range of motion is. How well can the person move that area? Some pathology examples are CTS, carpal tunnel syndrome, DJD, which is degenerative joint disease. Some therapy examples, BMT, which is the abbreviation for bone marrow transplant, NSAID or NSAID are your non-steroidal anti-inflammatory types of drugs. And then we have TJR, which is going to be total joint replacement. Sometimes we have to replace the whole joint when the injury has occurred, or it could be due to wear and tear and age. Now, of course, these again are not all of the abbreviations, they're just some, but use your book, take a look at them, and if you have any questions, please let me know.